Good morning to you all. I'm Renee Francoeur with Cabinet Communications, and I'll be your moderator for today's COVID-19 update. We are joined today by the Minister of the Public Service Commission, John Streicker, and the Acting Chief Medical Officer of Health, Dr. Catherine Elliott. Closed captioning is provided by National Closed Captioning. Thank you to Kevin Klein for providing our ASL interpretation, and to André Boussier for providing our French translation. Following the remarks from our speakers, we will go to the media present in the room and then on the phone lines for a round of questions. I'll call you by name and you will each have 2 questions. Before we begin with our speakers, I would just like to verify that everyone can hear us. If any of the reporters are having any problems, please email ecoinfo@yukon.ca. I will now hand it over to Minister Streicker.
Thanks, Renee. Good morning, Yukon. Thank you for joining Dr. Elliott and I on the traditional territory of the Kwanlin Dun First Nation and the Taan-Quechin Council. I'm happy to be here just a few days before Christmas to let everyone know more about how our territory is doing when it comes to COVID-19. First and foremost, let's start by wishing everyone a very happy holiday. Yesterday was winter solstice and longest night, and I always mark solstice as the start of our return to the light. And I hope everyone enjoyed it in their own special way, whether that was with a walk or a ski or hanging out at home and snug in contemplation. For me, it has always been an important moment of transition, and it reminds me of what I love about living here in the Yukon, about seasons in general. It's an important moment to pause on our journey as Yukoners back into the light and to honor change in general. There certainly have been many changes since the 2020 holidays. This time last year, we were all eagerly awaiting the first vaccines to arrive. Premier Silver negotiated with the federal government to ensure that northern, remote, and Indigenous communities across Canada received priority access to the vaccines. We were fortunate to receive the vaccines early, and I'm grateful for that. Most Yukoners were able to receive 2 doses before other Canadians had even begun their shots. Myself, the Premier, and Minister Frost were invited to witness the arrival of the first shipment up at Eric Nielsen Airport. Since that time, less than a year, we have rolled out vaccines for adults, 18 plus, for the youth aged 12 to 17, and now kids aged 5 to 11. In fact, as of Monday this week, 40% of our children aged 5 to 11 have received their first dose. This is such positive news for the ongoing battle to slow the spread of COVID-19 and all of its variants. I listened to Dr. Catherine Smart, pediatrician and president of the Canadian Medical Association, on this live stream a few weeks ago with Dr. Elliott, encourage parents to get their kids vaccinated against COVID-19. Overall, now 87% of our population age 5 and up have now received a first dose, and 80% have received 2 doses. Well done, and thank you, Yukon. We know that the more Yukoners get vaccinated, then the safer we are as a territory. As previously announced, booster shots are now available for those aged 18 and up. Our focus ahead of Christmas has been to provide kids aged 5 to 11 with the opportunity to receive their first shots. In the coming weeks, our priority is booster shots for all eligible Yukoners. You are eligible for a booster shot if it has been 6 months since your second shot, and of course, you're 18 years or older. Walk-ins will be accommodated when possible, but remember that they are not guaranteed. Yesterday, we posted vaccine appointments for the first week in January, and I understand those appointments are now fully booked. It's great to see this interest in getting boosters. New appointments will be made available on a weekly basis. We recommend checking the vaccination booking website regularly. That's yukon.ca/thisisourshot. And my main announcement today is that we are working to increase our capacity to deliver booster vaccines. Simply put, we are seeking more immunizers to increase delivery of boosters at our clinic. at our clinics. We're looking across government to identify individuals that are available to be trained quickly to help with the rollout of boosters. This includes emergency medical services staff, pharmacists, and others. We have reached out to the federal government to explore what assistance Canada can provide to bolster our vaccine and booster campaign. I would also like to invite any retired healthcare professionals, such as nurses and doctors, who have experience providing vaccines to join our immunization effort. If you are available to offer your support, we would welcome it. Please reach out to your local community health center or the vaccine clinic here in Whitehorse to get back on the ice for Team Yukon. As the even more transmissible Omicron variant continues to spread, the best advice we have been given is to practice the safe 6+1 and get vaccinated, including a booster if you're eligible. Our high vaccination rate has been a critical part of our response to the pandemic and managing the ongoing risk. We've had 2 serious upticks in cases in the Yukon. For example, the end of the school year this past June, and again more recently last month. We know that the measures we brought in last month helped to check the Delta wave we were experiencing. We also know the recent waves would have been significantly worse if we had had lower vaccination rates. The Public Health Agency of Canada and our own Acting Chief Medical Officer of Health and her team tell us that vaccines and the Safe 6 are the most effective ways to protect our families, communities, and ourselves against COVID-19, and also the best way to make sure our healthcare system is not overwhelmed. I'm quoting now from the Public Health Agency of Canada. Canada's independent drug authorization process is known around the world for its high standards and rigorous review process. Decisions are based on scientific and medical evidence. Vaccines authorized for use in Canada are safe, effective, and of high quality. End quote. And so we continue to increase our vaccination rates to keep our territory safe. As we look forward to some family time and downtime over the holidays, I want to let people know about the hours for testing and vaccines. The COVID-19 Testing and Assessment Center here in Whitehorse and the drive-through testing site will be closed on December 25th and on January 1st, 2022. All other days, the testing locations will be open for regular hours, 8:30 to 5:30, 7 days a week for the drive-through site, and 8:30 to 6 for the COVID-19 Testing and Assessment Center. The COVID-19 Vaccine Clinic in Whitehorse at the Convention Center will be closed on December 27th, 28th, 31st, and on January 3rd. If you live in one of our beautiful communities, please reach out to your local health center regarding appointments. There will be vaccine clinics for children ages 5 to 11 in Carmacks and Carcross on January 13th, as well in Dawson City on January 14th. There is one today for children age 5 to 11 in Watson Lake at the health center there, and it goes until 3 p.m. Head on down or phone the health center at 867-536-5255 to book a time slot. For vaccines for Yukoners 12 and older, and for booster shots for those 18 and older, there are clinics in Carcross on December 29th, as well as January 13th and 27th, in Carmacks on January 12th, in Dawson City on December 29th, January 7th, and January 21st, in Haines Junction on December 29th, in Mayo on December 23rd, and in Old Crow on January 6th and 27th. You can find more information about the communities I didn't mention at, again, yukon.ca/thisisourshot. This is also the website where you can book your vaccine appointments online, and you can also call 877-374-0425 for clinic questions or any help booking your shots. With respect to the public service, I will give an update on attestation under the vaccine requirements, which we introduced 3 weeks ago. We now have 5,360 public servants who have attested to having their first shot of the vaccine. This is just under 95% of all workers and is up 60 folks from the 1st of December when we first introduced the requirement. We currently have 31 applications for medical or religious exemptions. We have 106 full-time employees on leave without pay, and we have 192 part-time or casual employees who have not attested. Together, this makes up less than 5% of our workforce. I would like to take a moment to thank all public servants, including those on leave without pay, for your service to the Yukon, and in particular, your service during this pandemic to keep Yukoners safe and well. Thank you very much. Before I hand it over to Dr. Elliott, I just want to thank each and every Yukoner for your resilience. I wish everyone a healthy dose of kindness this holiday season. The pandemic will continue to be challenging, but it is easier when we treat each other in empathetic and caring ways. It has been said by my colleagues many times, we're all in this together and we will pull through it together, and that's how our Yukon spirit rolls. Please stay safe, especially if gathering with others over the coming weeks. We need to continue to do everything we can to stop the spread of COVID-19 by getting vaccinated, practicing the safe 6+1, and working together to support public health measures to keep Yukoners safe and healthy. By the way, if you're doing any last-minute shopping, please continue to support local and buy Yukon products, and thank you for already doing so. Thank you, and a very Merry Christmas, Joyeux Noël, Happy New Year, Bonne année, Yukon.
Thank you, Minister Streicker. Good morning, everyone. Bonjour. I'm going to start with the case count overview today. Over the course of the pandemic, there have been a total of 1,651 Yukon cases, and 1,593 people have recovered from COVID-19. 14 Yukoners have died. Currently, daily case counts are steady at an average of 7.6 cases a day. There is ongoing community transmission in Whitehorse, and we do see cases in many communities. As of this morning, we have 49 active cases in Yukon. The current percent positivity is 10.6, indicating that a moderate number of people with COVID are not seeking testing, and I hope that anyone with symptoms is isolating, even if they make this choice. The dominant variant in Yukon is Delta, and we are seeing more Omicron cases. At this time, there are 2 active cases of Omicron in Yukon, and a number of contacts are under investigation and are isolating. What we're seeing is people who are returning from outside of territory have become infected and are coming home with those infections. This is what we expect to see at this time when we have a variant elsewhere that we don't have in high concentration here. And this is something that we've dealt with before and we will be able to manage now. These cases are in Whitehorse at this time. We've seen that there's no place in Yukon where COVID-19 can't reach. We've also seen that we can declare a state of emergency, we can put in public health measures, and we can manage the situation. Our situation has stabilized. However, we still do have Delta activity throughout the territory. To keep this season safe, we will need everybody's help. Omicron is a highly transmissible variant that spreads wider and faster than Delta. Vaccines are protective against Omicron and particularly against severe disease. Omicron is a puzzle, and it's a puzzle with some of the pieces in place where we have understanding and knowledge and other places where there are gaps. And as this knowledge continues to evolve, we'll continue to update. What we're seeing now is that Omicron is infecting those who are fully vaccinated, and this is contributing to the spread in those places with Omicron transmission. The early evidence on the severity is not clear on whether Omicron is milder, more severe, or the same as previous variants. We continue to watch this space. What we're seeing across Canada is young people, young adults infected, and this is a population who's largely vaccinated and who's unlikely to become hospitalized with your average COVID variant. However, what we see next often is transmission into more vulnerable populations. So we continue to watch and learn. We also know that even if Omicron turns out to be less severe than Delta, it still has significant potential to strain the healthcare system because of the sheer numbers of people who are becoming infected. Omicron is likely to become the dominant variant in Canada in the weeks and months to come, and people will continue to come to Yukon infected with Omicron. This includes both Yukoners coming home and visitors to the territory. Travelers can reduce the potential spread by taking a few simple steps in the first few days of entry into Yukon. This is why I'm recommending that people who are entering Yukon, including returning Yukoners, take special precautions. During the first 3 days upon entry, travelers should limit their contacts to a bare minimum and definitely to those within a single household. During the first 5 days, they should plan to stay home or with close others and take trips into the community or to do only essential activities. Particularly avoid contact with those who are at risk of severe disease, such as seniors, elders, those with chronic disease, and those who are not fully vaccinated. Throughout people's time in Yukon, whether Yukoners or from away, it's important that we keep our number of contacts reduced and strictly follow all the public health guidance. During the time following return, any symptoms of COVID should let a person know that they need to isolate and call 911 or the COVID info line, 811 or the COVID info line for the next steps. For many people, this will take some planning to ensure that you have what you need. It may mean that others in the home need to be running the routine errands. I'm recommending these small steps at this time to limit the impact that any person who arrives infected with Omicron will have while still supporting our important connections with other provinces and territories. I know that many people have limited their travel at this time, whether domestic or international, in order to avoid the risks for themselves. This does reduce the risk of importation, and I appreciate that people have decided to make these hard choices. For those who are traveling, please do follow this recommendation. Within Yukon, when we're traveling, let's take special care of our communities and check the website of the First Nations governments before traveling. In the weeks and months to come, we'll learn to live with Omicron. Until that time, it's wise to limit our activity upon return to territory. For international travel, whether to the US or farther afield, the Government of Canada is advising travelers, regardless of their vaccination status, to avoid non-essential travel. If you choose to travel outside the country, please note that as of yesterday, all Canadians returning from even short trips must take a molecular pre-entry test and that this test cannot be taken in Canada before you leave. Please follow this guidance, and international travel should be avoided unless it is essential. Further guidance and advisories are found on the Government of Canada website at travel.gc.ca. We all want a safe and happy holiday. Omicron is making this more challenging. It's a good time to slow down, to keep group sizes small and consistent. So let's talk a bit about holiday gatherings. Gatherings are lowest risk when they're held with people from your immediate household. If you choose to gather with people from outside your immediate household, please limit the size of your gathering to a minimum of 10 people from no more than 2 households. Choose lower risk activities and layer on the Safe 6 protections and wear a mask. Remember that the risk of COVID-19 transmission increases when the 3 C's exist: closed spaces with poor ventilation, crowded places with large numbers of people, and close contact where it's difficult to physically distance from others. Looking at holiday gatherings from this risk perspective, some low-risk holiday activities would include indoor celebrations with your immediate household, virtual holiday celebrations, dropped-off or physically distanced doorstep gift exchanges, outdoor celebrations in open spaces where people can maintain at least a 2-meter distance. High-risk holiday activities would include being in closed spaces with poor ventilation, in crowded places where many people are gathered, talking to others within close range, or being in prolonged close contact, particularly with those people who are not your consistent contacts. Things that cause more respiratory droplets, such as singing or shouting. This is a tough time, and we've all had to make changes. I can tell you myself, I had some activities planned, including visiting people who are more vulnerable, who I haven't seen in a while, and I'm going to cancel and modify those plans. Pay attention to your mental health in this holiday season. We know these connections are so important for our mental health, and so it's a time to try to find ways to connect that are safer. If you are feeling overwhelmed, try reaching out to a supportive friend or family member. I know that video conferencing, video calls, phone calls, emails, texts, staying connected in all these ways are just so important right now. If you live alone, consider spending the holidays with another household. We've posted more information online on holiday planning guidelines at yukon.ca/holiday-planning-guidelines. So what's happening in public health? Well, we're continuing to carefully manage the contacts of people who are suspected of having Omicron. This includes requesting that more people isolate after they've been exposed to the case, even if they're fully vaccinated. This caution is necessary to curb transmission because Omicron does infect people who are vaccinated, and vaccinated people can transmit to others. With such a rapidly spreading variant, this is really important to limit transmission. This is also why limiting the number of contacts you have and using these layers of protection is so important, even for those who are fully vaccinated. Please follow the advice of YCDC, whether it's given to you directly or it's offered through online guidance. I am really so grateful for this hardworking and tireless group of healthcare professionals at YCDC. They have been working since before many of us knew the name COVID-19, when we had a novel coronavirus that was in China and seemed very far away. They have been working for 2 years through and will continue to work through the holidays again this year to support those with COVID-19 and to limit the spread. I am so grateful for this dedicated and excellent team. Now I'd like to discuss the state of vaccinations in the Yukon. Minister Streicker gave a lot of numbers, and I'll repeat a few of them here, but I won't go into great detail. They're all available on yukon.ca. The bottom line is each week we see more and more Yukoners vaccinated, and this is so important to curb the spread and especially to reduce severe COVID. The numbers of cases we're seeing with Omicron have real potential across the country, have real potential to strain the healthcare system. And this is another reason why vaccination is so important. At this time, we have 88% of eligible Yukoners who have had their second shot. 29% have received a booster, 78% of youth have had their second shot, and 40% of children, ages 5 to 11, have received their first shot. We remain committed to making booster shot available to every Yukon who's eligible in January. And people become eligible if they're adults and they're 6 months or more after their second shot. If you find yourself in a clinic in the upcoming weeks, please treat the staff there with respect and kindness. Many people have been working long and hard. Many people are joining the team for the first time. Please join me in thanking this group when you see them. This is such a beautiful time of year, a time when the days are starting to get longer. And this year, it might be harder for many. This is the time to be kind. Yukoners have stepped up throughout this pandemic to get vaccinated, to follow public health guidance, and to curb transmission, even when it's not convenient, even when we don't want to, even when it's very hard. And now we have a new challenge on the horizon. This is not what was predicted. It's not what we wanted. And yet it's what we're facing. And we will face it bravely and wisely as Yukoners do. Reducing our activities now is so very important to keeping transmission down and reducing those risks of importing cases of Omicron. We can all slow down. I can tell you, I like to move quickly. I like to do a lot of things, and we all have to slow down. Slowing ourselves down means enjoying time with our closest contacts only, using those layers of protection, staying away from others after travel, and if we have any symptoms at all, keeping those who are most vulnerable safe. I wish you all a safe and happy holiday season and to enjoy the joys of the simple things in life. Shonitan Gunalchish, Masi Cho, thank you, merci.
Thank you, Dr. Elliott, and thank you, Minister Streicker. We'll now move on to the question and answer session with media. A reminder to reporters, please identify which speaker you would like to answer your question before you start, and please also remember to mute and unmute yourselves. As we have no reporters present here in the room, we'll go to the phone lines, and we will start with John at CKRW.
Hi, I'm not entirely certain who this applies to, so Minister or Doctor either or. I'm interested in knowing about some of the slowdown with the vaccines. Namely, it's kind of impossible to try and book an appointment. Every time some show up, they vanish just as quickly. So I was wondering if there's any sort of internal effort to try and alleviate the lack of appointments for boosters and vaccines or anything of the sort.
Thanks, John. Yes, there is. So one of the reasons that it's going to feel like that was because up until about now, we've been focusing on the vaccines for children aged 5 to 11. So we did not have as many slots available for adults. But those are now coming online. Yesterday, as I noted, we put a week's worth of appointments up for the first week of January. And I saw them starting to go last night. By this morning, before I was finishing up my last meeting, they were all taken as appointments. We will continue to put them up 1 week from now or early next week. We will put up for the second week of January. And what we're doing right now is recruiting more people to give those immunizations, because then we can get more appointments out there. So we're working to draw more people in from within our public service. I mentioned, for example, pharmacists, but we're also reaching out to people that have done vaccinations in the past. I know, for example, of some people that teach up at the university, but they teach healthcare and they have done vaccinations before. So we're reaching out to colleagues to see if they will come back, because we've heard from Dr. Elliott how important it is to get those boosters to Yukoners as quickly as possible with the Omicron wave that is coming across Canada. So we are working very hard to do that. The last thing I'll mention is that we have as well reached out to the federal government to seek 5 to 10 people to come forward, and they were surprised to hear us ask for just 5 to 10 people, but that number is significant for us because it will increase the number of vaccinations we can get daily by anywhere from 100, 150, maybe more. And those numbers make a difference for us. So as Dr. Elliott has noted, our goal is to get those boosters into Yukoners' arms as soon as possible, and we are working to ramp that up, to boost it, I guess.
Thank you. John, do you have a second question?
I do. Another part that I was interested in getting some information about has to do with efforts to actually recruit a chief medical officer of health. I'm not certain if Dr. Catherine Elliott will be taking that position or if there's somebody who's supposed to be incoming, but I'm just wondering if there's any update on how we're progressing towards having someone in the position.
Do you want the closing list? No. Okay. Thank you, John. What I will say is that we have been advertising that position right now, and it is open for people to apply. Of course, we know that there's been pressure on all healthcare service providers across the country and probably across the world, but that position is open right now, and I'm not sure of the closing date and when choices will be made, but that is being recruited as we speak.
Thank you. We'll now move on to Haley at Yukon News.
Thank you. Question, I think, for Dr. Elliott, although, Minister, please respond as well if you can. I'm wondering if you could just talk about the decision to release guidelines for the holidays rather than mandated restrictions that we've seen in other jurisdictions.
Yeah, I'm happy to answer that question. Thank you. Here in Yukon, we had a Delta wave that started in November, and we implemented a state of emergency and a number of measures at that time. A lot of those measures correspond to measures that are now being put in place in other places. Granted, if you live in Quebec, the measures are extremely strict at this time and beyond what we have here in Yukon. We are prepared to use further measures as needed. This Omicron variant will require vaccination and public health measures to respond. And at this time, we don't need to put in further measures. Measures are the heavy hand of the law. I would prefer if people choose to do the right thing, and I know most Yukoners do that. However, if we get into a situation where we need further measures, we're ready to do that and recommend those to government. Thank you.
Renee, I'll just add, just on, I think this has been our way of working all along, Haley. It is to, I think that our medical folks and our specialists, they stay on top of the situation. They provide us regular advice, and we adjust. We, as Dr. Elliott notes, we did that in November, and just ahead of that wave, recall that we brought in the requirements for vaccinations for non-essential businesses and for the public service. And then the wave hit, and then we increased them again following the recommendations that were given to us. So we will continue. I think that we always have to keep an eye on what the situation is, what the risks are, how we're doing as a territory, and then we get those recommendations and we will respond. And so what I can tell you is that there's constant contact between Dr. Elliott's team, Health and Social Services, and the cabinet, so the government, so that those decisions happen as quickly as they can once the recommendations are made.
Thank you. Haley, do you have a second question?
I do. Yeah, I wanted to ask about the 40% rate for children that have been vaccinated. Knowing that, we're about to move into, I guess, a more high-risk period over Christmas, and that getting shots in the arms of kids was a priority. Are you happy with that 40% rate? Was that what was expected, or was that low? Just looking for some context around that number.
Every time somebody who's eligible gets vaccinated, it's a good thing for all of us. And 40% of children stepping up is very, very strong results. And we continue to offer vaccines to children, and there'll be some more children stepping up today, this week, and we'll continue to do that. At this time, vaccines, one of our strongest tools in the toolbox, and we're really happy with what we've seen so far with children. Thank you.
Can I just add, I looked up the numbers for nationally what the rate of vaccination is with children aged 5 to 11. So the national average is 30%. So again, the Yukon is doing well. Of course, we always want it to be more, and we'll continue, as Dr. Elliott has noted. But we thought that was a good start.
Thank you. We'll now move to Joseph at CBC.
Good morning. My question is for Minister Streicker. We've seen rapid testing kits being distributed in the NWT, and I'm wondering why aren't these tests being given out here, and are there plans to get these kits into people's hands?
Thanks, Joseph. I suspect this is a better question for Dr. Elliott. And so what I will say is that we of course, look for this advice. We have used tests well in the territory to date, but as I said just a moment ago, we will continue to monitor the situation to see how things are adjusting. But I really feel that Dr. Elliott would be better positioned to talk about testing as she's the medical expert.
Sure, happy to. Listen, testing for COVID, it's really about the right test for the right person at the right time. I know that sounds like a catchy slogan, doesn't mean a lot to a lot of people. But what I will say about testing is we have a whole menu of selection of different types of tests, and each one has its place. And it's not as straightforward as many people think. And if anyone's watching news in other parts of the country, you'll start to see a lot of shifting and movement right now in testing. Some places will open new programs where they haven't had them, as we have seen in NWT. Other places will need to move their testing programs. Nova Scotia, that's been testing a huge number of people throughout the pandemic, is now shifting their testing, decreasing availability because of the need to focus that testing on where it's most needed. We in Yukon have used our testing well. We can see that by the results and how we've done in terms of our morbidity and mortality, or the impact of COVID has had on our population. And we will continue to use testing where it's the right fit. So, for example, we've used rapid test kits in congregate living settings such as mines when we have cases. We use rapid testing in hospital, in other vulnerable settings such as the shelter, detox. We've used it at the Whitehorse Correction Center. Our rapid testing teams take rapid testing, our rapid response teams take rapid testing to communities or other places where it's needed. So we have these tools, and we use them when we need them and appropriately. Testing is not the be-all and end-all. It's a piece of the toolkit, and we will continue to use it and prioritize those places where it's going to most benefit the reduction of transmission of COVID-19 and the control of COVID-19, particularly with the Omicron variant. Thanks.
Thank you. Joseph, do you have a second question?
Yes, I was wondering if we could get an update on the situation in Old Crow. We heard about a rapid response team being sent there last week. What have they been doing to keep the virus under control there?
Yeah. I'm just going to get you some numbers here. I know I'd love to have these numbers here. Okay, so what's been going on in Old Crow? Well, Old Crow, we've been very busy in the past couple of weeks responding to the situation there, and we've worked very closely with the Vuntut Gwetchin government and a chief and council and community members to support people with COVID-19, to get people tested and get them the care they need, to help isolate people, etc. We continue to see a high rate of testing in Old Crow, and we continue to see cases. I'll be honest, I don't have the exact numbers with me this minute, but I do have a high testing rate. And what I'll say is that this has not been an area of risk anymore. About 2 weeks ago, we see things coming, so we're always kind of one step ahead of what the next risk area is. And Old Crow is a situation that is settling, it's under control, and it's we continue to be active there. However, it's not one where we feel there's a lot of uncertainty anymore. It's one that's under control. Thank you.
Thank you. We'll now move to Maya at CBC.
Hi. My first question is for Minister Streicker. So we're learning there are first responders off the job in several more Yukon communities, including Tagish, Teslin, and Pelly Crossing, leaving these communities with reduced or no access to emergency medical services. Do you have any plans to remedy this and make sure Yukon's communities have access to these essential services?
Yes. Thank you for the question, Maya. First of all, I want to be careful to say that we do know that there have been some volunteers who have not attested for EMS and fire across our communities. And in each one of those situations, we're sitting down to work with that community to cover off that service, whether that is with additional supports from Whitehorse or whether that is with allied or neighboring communities, so that there is coverage. We sit down and work through to see whether there are other volunteers that can step forward. And we also try to increase other capacities. So, for example, if the community is a little further away, we'll look to make sure that we've got medevac available. And we might position other resources there, like additional ambulance. So it depends on the community which way those solutions have been sought. But the Department of Community Services is working to have those plans in place. I think it's also important to note that we brought these measures in because these communities are vulnerable to COVID as well, right? And so one of the best examples for me was the Whitehorse Correctional Center. We had a COVID outbreak, but we also, just ahead of that, asked that our employees who were not vaccinated to step away, to take leave without pay. Imagine if that outbreak had happened when we had all those staff there who were unvaccinated, because of course unvaccinated people are very vulnerable to COVID. So there is a risk as well to keeping people in those positions, so in those sort of frontline positions, and So yes, we are worried about the pressures that come when people step away from their volunteer position in our communities, but we're also worried if there is the additional risk of COVID in those communities. So each department across all of its staff and volunteers looks to see where those pressures are and provides a plan about how there's going to be the service provision. In this case, it would be for, say, EMS service across these communities. And I spoke yesterday with Minister Mostyn and with the Deputy Minister about those plans, and they are in place.
Thank you. Maya, do you have a second question?
Yeah, just following up to that, just for the people who are living in these communities right now, and they have a medical emergency, and regular first responder staff are not on duty. What exactly should they do?
They should call 911. So we have when you call 911, we have a system here that centralizes the dispatch, and then that plan has been shared with that dispatch so that they will reach out to those volunteers that are in place. And then if those volunteers are not available, which sometimes is true anyway with volunteers, then they'll work through the continuity service plan to go to the next step for service provision. So for the public, the answer remains the same. Please call 911 if you have a medical emergency. We will work to support you across all communities.
Thank you. We'll now move to Tim at the Whitehorse Star.
Yes, good morning. Can you hear me?
We can. Thanks, Tim.
Okay, so both of my questions are for Minister Streicker in regard to the vaccine mandate. The first one is, if you can tell me whether or not there was a spike in resignations in between the announcement of the vaccine mandate and its implementation. Were there more people than usual quitting?
Yeah, thank you for the question. I did ask the Public Service Commission to look into resignations or retirements, both, and to see if we could tease out how many of them were specific to the vaccine mandate. The early numbers that I got were that there were, and it was a low number, Tim. I think it was around a dozen, maybe 11. I'll have to check on that number to be sure, and I will make sure that we reach back out to you if that number is not exactly correct. But I've asked them to continue to looking at this. The numbers, as I noted, for attestations and for exemptions, they're still settling, like they're still changing a little bit over time. And so those resignations may change as well. And I've asked for there to be a look at it and follow up with those people who have stepped away, to interview them, to get their perspectives on what has motivated them. And I think we do that generally as people retire, but I've specifically asked in this case. So there is a number, although it's not a large number, but we'll continue to monitor it.
Thank you. And your second question, Tim?
Yes. Do you also happen to have any figures on how much money the government is saving with this 100 and some full-time people being on unpaid leave and the casual and part-time?
Yeah, I don't yet, Tim. And I think, though, can we acknowledge that we're still trying to provide the same level of service as a government. So that one of the ways in which we do that is we ask other employees to take on those roles. And so that puts a pressure back on our existing staff, or the staff that have attested, and sometimes that might even mean overtime. So I'm not sure that we're anticipating that there is a significant savings. It certainly was. I want to be very clear that there was no motivation on our part around this. This was about trying to protect the public health. It was the clear advice that we got from the Chief Medical Officer of Health and her team. And I don't know that we have any numbers. I think we will be watching over the coming months to try and understand whether there is a change to those costs for employment. I'm not thinking that there will be, but we will be watching it. So as of now, no information that we have about this, but I don't think it will be just a one-sided sort of look. It will include how COVID pressures have been dealt with over time as well.
Thank you. We'll now move to Vincent at Radio-Canada.
Oui, bonjour. Une question pour Dr. Elliott. Juste pour revenir sur les tests rapides, l'opposition les réclame et dit qu'on en a des dizaines de milliers en réserve. Du coup, je comprends bien ce que vous avez expliqué sur les différentes utilisations de ces tests, mais pourquoi ne pas les généraliser si on en a autant? Est-ce que vous pouvez me répondre à ça en français, s'il vous plaît?
So the question is for Dr. Elliott. Given that we have the tests right now, we understand that there are thousands of tests that are available. We understand the difference between the different tests that you said, but is there any reason why they are not made more available since we have them right now?
Merci pour la question au sujet des tests rapides. On a des tests rapides ici au territoire et on les utilise où et quand ils sont importants, très importants pour le contrôle de COVID-19. C'est pas si simple de donner des tests rapides à tout le monde et pour qu'ils peuvent se tester. Il y en a des gens ici qui ont reçu des tests rapides par des autres moyens et ils les utilisent et c'est pas problématique à ce moment-là, mais pour le gouvernement c'est très important de avoir le focus les activités vraiment prioritisées où nous trouvons il y a des importantes actions pour le contrôle de COVID-19. Par exemple, au centre de correction ici à Whitehorse, nous avons eu une éclosion et dans le contrôle de cette éclosion, nous avons utilisé des tests rapides qui sont dans la clinique au centre de correction. C'est juste arrivé il y a comme une semaine. Et aussi, par exemple, pour la situation à Old Crow, nous avons utilisé les tests rapides avec l'équipe de réponse rapide qui était là le jeudi et vendredi dernier. Nous voyons aussi qu'il y en a des problèmes parfois dans les juridictions qui ont donné beaucoup de tests rapides aux gens et maintenant il y a des gens qui il y a raison de garder ces tests rapides pour les situations qui sont très importantes. Et nous avons perçu cette avenue au début et nous continuons dans cette avenue comme ça maintenant. Merci.
Thank you. Une autre question, Vincent?
Oui, merci. Est-ce que vous pouvez juste répéter en français les directives, les recommandations que vous donnez pour les Yukonais qui reviennent ici pour les fêtes et juste tout simplement pour les recommandations pour les fêtes, pour les Yukonais?
So could you please, Dr. Elliott, repeat in French, what are your recommendations for people coming back from travel and for Yukoners who are simply here and will celebrate the holidays?
OK, bien sûr. Aujourd'hui, j'ai fait des recommandations au sujet des gens qui viennent au Yukon, d'autre part du Canada, même si ce sont des Yukonais qui retournent ou bien des gens qui visitent ici ou bien qui travaillent ici. Je recommande que ces gens limitent leurs contacts très important dans les premiers 3 jours de rester chez soi, limiter les contacts et certainement limiter les contacts des gens dans la même maison de vous. Et pendant les premiers 5 jours de garder les contacts au minimum. Pendant ces périodes-là, c'est mon recommandation qu'il fait seulement les choses dehors de la maison qui sont essentielles et qu'il demande aux autres de, par exemple, prendre de l'alimentation ou bien des médicaments ou bien ces choses où ils peuvent faire ces choses-là. C'est aussi très important de pratiquer très super bonnement les 6 moyens de se garder soin sauf et aussi porter son masque, mais fait ça le plus parfait qu'on peut. Pendant cette période-là, si vous avez des symptômes, c'est très important de soit isoler et aussi de appeler 811 ou bien regarder au Yukon.ca pour le test des symptômes pour voir comment se tester. Il y a beaucoup de Omicron au Canada et ça devient le dominant variant dans quelques provinces déjà et ça arrive aux autres provinces dans les semaines et les mois qui viennent et c'est pour ce cause-là que c'est pas une surprise que quand les gens viennent d'autre part, que s'ils ont le COVID-19, c'est vraiment possible qu'ils ont le Omicron. On veut garder les voyages qui sont très importants de nous, avoir les connexions, mais aussi, en même temps, on demande cette petite chose à faire pour garder le Yukon le plus sauf et sain possible et d'avoir des bonnes vacances. Je souhaite une bonne vacances de l'hiver à tout le monde ici au Yukon. Merci.
Thank you. Do we have any reporters on the line I might have missed? All right. Well, that concludes our COVID-19 update, the final one for 2021. But remember, you can continue to find the latest information on yukon.ca. We will see you again in 2022. Thank you to our speakers, and thank you to all the media and everyone else who joined us on Facebook Live. Remember to stay safe, be kind, and have a very happy holiday, Yukon.